My name is Carly. I am currently a pre-medical student with the goal of going to medical school and becoming a physician. And because of this, I wanted to talk about some of the struggles that women face in the healthcare system. So there are many examples of discrimination and biases in the medical field, and a very prominent example of this is gender discrimination, for not only female patients, but for female healthcare workers as well. Just some of the examples of this include long-term and undiagnosed health issues because women are less likely to be taken seriously when seeking a diagnosis or when they are in pain. There are also many gaps in medical research because very often research is only conducted based on men's bodies and men's hormonal cycle. Black women and women of color have much harder time and face much more frequent discrimination in the healthcare system. One example can be seen in the statistics about maternal mortality rates. And women that work in healthcare face many obstacles. Women working in healthcare are often forced to deal with harassment in the workplace as well as being discriminated against and underpaid based on their gender. So my first example, that women are less likely to be believed or taken seriously when they are seeking a diagnosis, means that women's pain is often downplayed, and women are often told that they have to deal with the pain. And a global study conducted by the Faculty of Health and Medical Sciences at the University of Copenhagen, they found in connection with 770 types of diseases, women were diagnosed later than men. For these 770 diseases, there was an average diagnosis difference of about 4 years. In the case of cancer, women were on average diagnosed 2.5 years later than men. For metabolic diseases such as diabetes, women were on average diagnosed about 4.5 years later. Women are much more likely to have to wait a significant amount of time for a diagnosis and for treatment than men are. Women's pain is often not seen as real or as over-exaggerated, even though women are much more likely to have autoimmune disorders, mental health disorders. Until fairly recently, it was even believed that men were the only ones that suffered from bleeding disorders, which has been proven untrue. Women are often told when seeking a diagnosis that the cause of their pain is their menstrual cycle or the chance of pregnancy, even with no evidence of the such. Women are also prescribed painkillers at a much less frequent rate than men are, even if it's truly needed. Women are more likely to be referred to therapists, while men are more likely to be prescribed medication for pain management. So my second point, gaps in medical research. Most medical research historically has been conducted using only male subjects. This leads to many problems, such as women are much more likely to have adverse reactions to medication, and medication is often less effective than it is for men. This lack of research also means that people in the healthcare field are much less likely to recognize medical emergencies in women, such as heart attacks. In many schools, healthcare workers are often taught the signs of heart attacks, but only the signs that men typically present with. Women typically present with different symptoms than men, so women are often not found to actually be having a heart attack until much later than men, oftentimes until it's too late. This can also lead to medications and treatments being less effective for women that take it, which can lead to longer illnesses and an extended recovery time. This also leads to misdiagnosis in women and the belief that diseases are primarily linked to males, even though women just present with different symptoms. It was believed for many years that a lot of people still think that ADHD is a disorder that is primarily present in men. But more recent studies show that women are just as likely to have ADHD, but are misdiagnosed often with depression or anxiety. Women with ADHD often have different symptoms, so they never receive the correct diagnosis. Here's a video. It's from Demystifying Medicine on YouTube, and it explains just a little bit more about this.
It wasn't until 1993 that women were required to be included in most healthcare research studies. Studies that did include women before this time were overwhelmingly related to reproductive science, showing a failure of the scientific community to recognize that the spectrum of a woman's health extends much farther than her ability to have children. The exclusion of women from research into other fields of healthcare was also due in part to the theory that the cycling of hormones made them imperfect candidates for research, although hormone cycling takes place in men as well. The result of this faulty logic is that most healthcare research carried out in the 20th century was done on young white men. The implications of this lack of diversity are still felt today. Countless drugs that are still used have only been tested on men, leaving women susceptible to care that is less effective or even harmful. Women are more likely to experience adverse reactions to antihistamines, antibiotics, and many other classes of drugs. For example, antiarrhythmic drugs pose a greater risk of causing a potentially lethal cardiac rhythm in women. This historical exclusion of women from research has not only affected our knowledge of the mechanisms of certain drugs, but also means that the scientific community is behind when it comes to understanding other domains of women's health.
Okay, so race and gender discrimination is also linked in healthcare and is also a very big problem. Black women and women of color are often greatly discriminated against. When it comes to maternal mortality rates, Black women and women of color are much more likely to have deadly complications than white women. Black women are almost 3 times as likely to die of a complication from childbirth in the United States than white women, and Hispanic women have a much higher mortality rate than white women as well. This is because Black women and women of color are often taken way less seriously than white women and have to find more for tests and to find what's wrong with them. A study conducted by Dr. Megan Hansen at Florida State University College of Medicine found that throughout the country, average wait times for pregnant women in emergency departments differed greatly depending on race. Black women, on average, waited 46% longer than white women. This leads to Black women experiencing pregnancy complications such as hypertension and preeclampsia at much higher rates. These complications lead to extremely high rates of maternal and infant mortality. These rates are much higher in the U.S. for Black women and women of color than they are in many countries without the access that we have to health care. Not just the maternal mortality rates, but there's a lot of racism in pain management as well. For a long time, it was taught in medical school and nursing school that people of color and Black people feel pain differently than white people, and that Black people and people of color have a much higher pain tolerance than white people. This belief is rooted in racism and has been proven untrue many times, but still older physicians and the physicians that they teach hold these beliefs. These beliefs often lead to underprescription of pain management and leads to people of color being expected to live with pain because it is not taken seriously. This also leads to issues beyond just physical problems. People that are denied needed pain management oftentimes struggle financially because people in pain are on average going to have to spend more time at doctor's appointments, which is in itself an astronomical amount of money in this country, but also oftentimes requires people to take off work, which leads to financial hardship as well. So women that work in healthcare oftentimes face a lot of harassment in their workplace. A recent analysis of 33 studies of about 18,000 nurses found that 28% of them had reported sexual harassment while on the job. And often this is just women that felt safe enough to report. Many times, women in healthcare are victimized by their superiors and risk losing their jobs and their incomes if these crimes are reported. This study shows that most often the only question asked to these nurses in these studies was just, have you experienced sexual harassment? And while 28% in itself is an alarming statistic, it is thought to be quite an underestimate because many women do not feel comfortable or feel able to report or talk about sexual harassment. It was also found that sexual harassment starts at oftentimes very early in their careers, many times being as early as training to become a nurse or a healthcare worker. This often makes it where women are less likely to report harassment because it creates a power dynamic that makes it where women feel like they need to just accept the fact that they're being sexually harassed in order to be able to work in this profession, which is something that is just not true, and people need to be held accountable for committing these crimes. Women also face a lot of discrimination based on their gender as healthcare workers. Women in healthcare are also paid at a much lower rate than men. While the healthcare field employs primarily women, about 70% of healthcare workers being women, they still are paid much less than their male counterparts and are underrepresented in medical publications and reports. Male surgeons earn an average of about $2 million more throughout their careers than female surgeons. In a recent study, it was found that female surgeons are overall better surgeons and are with better surgical outcomes and fewer post-op complications. So you would think that the surgeon that gets paid more is the surgeon that has better outcomes, but that is just not the case because of the biases in healthcare. And not just surgeons, but this can be seen in every part of healthcare. I mean, everybody knows that nurses are extremely underpaid because nursing is seen as traditionally a woman's job. So people think that it's okay to not pay them fairly. And this is not just a problem for women, but everyone. So, like I said before, 70% of healthcare workers are women, and people are going to continue leaving the field if they're not being paid enough. And that is definitely a problem that we are already facing, because no matter how much you love working in healthcare and how passionate you are about it, it's just not a feasible career choice if you're not going to be making enough money to live on. And sadly, as long as it's seen as a women's job, it's going to continue to be underpaid, because that's just the reality of what it's like in the country and in the world today. So these are just a few of many examples of the many types of discrimination in the healthcare system that people face every day. I think that there are ways to improve these problems, but the biggest hurdle that we face when trying to solve these problems is the lack of acknowledgement that they even exist. That is easy for people to ignore the problems instead of face them. But these issues cause problems for many people and it need to be acknowledged and fixed. It is also important that people realize this isn't just a women's issue either. It affects everyone and creates an environment that is unsafe for many people. And also, there are many other biases in the healthcare system, and they're all tied together. So each and every one of them needs to be fixed, and the people that perpetuate these problems need to be held accountable.